Look at your palms for a moment. Not the lines people claim can predict your future, but the color, the temperature, and the way the skin responds when you press it. In some cases, subtle changes in your palms can reflect problems with circulation, oxygen delivery, or the amount of work your heart is doing. Now, that does not mean every pale, red, cold, or sweaty palm is a warning that something is wrong with your heart. Many harmless things can change how your hands look, including room temperature, anxiety, dehydration, certain medications, anemia, and even your natural skin tone. But when a change in your palms is new, persistent, or appears alongside shortness of breath, chest pressure, unusual fatigue, dizziness, or swelling, it deserves attention. And there is one mistake many older adults make. They notice a change in their hands, blame it on age, and wait for it to disappear. Sometimes it does. But sometimes the hands may be quietly revealing that blood is not moving, or carrying oxygen, as efficiently as it should. In this video, you will learn which changes in your palms may be more concerning, which ones are usually less serious, and what other symptoms make the difference. You will also learn a simple color return check you can do safely at home, plus the exact warning signs that mean you should seek urgent medical care instead of waiting for a routine appointment. Stay with me because the most dramatic-looking palm is not always the most dangerous one. In fact, one of the easiest signs to ignore may matter more than redness, visible veins, or cold fingers. By the end of this video, you will know how to look at your palms without panicking, what patterns to watch over time, and how to describe those changes clearly to your doctor. Your hands cannot diagnose heart disease, but they may give you an early reason to pay closer attention. Before you judge what you see in your palms, you need to understand one important idea. Your hands sit at the far end of your circulation system. Blood leaves the heart, travels through the arteries, passes into smaller vessels, and eventually reaches tiny capillaries near the surface of your skin. That makes your hands sensitive to changes in temperature, stress, oxygen levels, blood volume, and circulation. But this is also where people can become frightened unnecessarily. A change in your palm does not automatically mean your heart is failing. Cold air can narrow blood vessels. Anxiety can make your hands sweat. Dehydration can reduce blood flow to the skin. Anemia can make your palms look pale because your blood may be carrying less hemoglobin. And a condition called Raynaud phenomenon can temporarily make your fingers cold, numb, white, or blue after exposure to cold temperatures or emotional stress. The heart becomes more relevant when the change is persistent, when it appears without an obvious trigger, or when it arrives with symptoms somewhere else in your body. For example, blue or gray coloring can sometimes happen when tissues are not receiving enough oxygen, but lung disease, airway problems, and circulation disorders can also cause this. New paleness accompanied by breathlessness, weakness, dizziness, or a racing heartbeat may point toward anemia, or another condition that is making the heart work harder. So here is the key distinction. Do not ask only, what color are my palms? Ask yourself, is this new for me? Does it remain after I warm up and rest? And what else is happening in my body at the same time? That combination matters far more than one isolated sign. Compare both hands in natural light. Indoor bulbs can create misleading shades, and skin tone can affect how color changes appear. Look at your palms, your fingertips, your nail beds, your lips, and even the inside of your lower eyelids instead of relying on one small area. And remember, your palms are not a diagnostic test. They are a clue that may tell you whether to continue watching, schedule a medical appointment, or seek help urgently. Now consider a very common situation. A 72-year-old man notices that his palms seem paler than usual. He assumes it is because the weather is cold. Over the next 2 weeks, he also becomes tired after walking from the living room to the kitchen. He begins pausing halfway up the stairs, but he tells his family, "I'm just getting older." One morning, his daughter notices that the color in his hands does not seem to return quickly after she presses one of his fingertips. She also notices that his ankles look slightly swollen. None of these signs by themselves proves heart disease, but together, they suggest that something has changed and that change deserves medical evaluation. At the clinic, the doctor does not diagnose him simply by looking at his palms. Instead, the appearance of his hands becomes one piece of a much larger picture. The doctor checks his oxygen level, his heart rate, his blood pressure, his lungs, his circulation, his blood count, and his heart function. That is the correct way to use a visible sign, not as a final answer, but as a reason to investigate. This matters because many older adults slowly adapt to symptoms. They walk less, they rest more, they stop doing household tasks that suddenly feel difficult, they avoid the stairs, they sit down more often. And because the decline happens gradually, it can start to feel normal. Quick favor before we go further. Tell me your city, state, or country in the comments. Seeing where viewers are watching from helps me understand who is listening, and helps shape future advice around the concerns people face in different places. Now stay with me, because the first palm color change we are about to discuss can be surprisingly easy to miss. especially in a dark room. The lesson from that story is simple. A new change in the hands becomes more meaningful when it appears beside breathlessness, swelling, weakness, dizziness, chest discomfort, or reduced stamina. Do not panic over one clue, but do not dismiss a pattern simply because it arrived quietly. Now let us begin with the palm changes that tend to create the most concern: unusual paleness or a blue or gray tone. First, paleness. Your palms may naturally look lighter than the backs of your hands. So the important question is not whether your palms are pale compared with someone else's. The real question is whether they look different from your own normal color. Persistent paleness can occur with anemia. Anemia means the blood does not have enough healthy red blood cells, or enough hemoglobin, to carry oxygen efficiently. Anemia may also cause fatigue, weakness, dizziness, cold hands, shortness of breath, or a faster heartbeat. It can force the heart to work harder, but pale palms alone do not prove that your heart is struggling. This is where the other symptoms become essential. If your palms look pale, and you have lost stamina, become winded during ordinary activities, or feel lightheaded when standing, arrange a medical evaluation. A doctor may check your blood count, oxygen level, blood pressure, heart rhythm, and other possible causes. They will not judge the situation by color alone. Now, blue or gray coloring is different. Doctors call this cyanosis. It can happen when the blood is not carrying enough oxygen, or when circulation to an area is reduced. Cold temperatures can temporarily make the fingers look bluish, but new blue or gray coloring that does not improve after warming your hands should never be ignored. And here is where you should look beyond the palms. Check the fingertips, the nail beds, the lips, and the tongue in good light. If blue or gray color appears suddenly along with severe shortness of breath, chest pressure, confusion, fainting, or difficulty speaking in full sentences, seek emergency medical help immediately. Do not drive yourself if emergency services are available. Here is the detail most people miss. Serious oxygen problems may be easier to notice around the lips and mouth than in the palms, particularly across different skin tones. That is why comparing several areas is more useful than staring at one hand. The safest rule is simple: a color change that is brief, linked to cold temperatures, and disappears after warming is usually less alarming. But a new, persistent change accompanied by breathing difficulty, weakness, swelling, or chest discomfort needs prompt medical attention. Heart failure commonly causes breathlessness, fatigue, and swelling from fluid buildup. But these symptoms require proper medical evaluation. They should never be diagnosed from the palms alone. Now let us talk about palms that look unusually red, feel persistently cold, or suddenly become sweaty for no clear reason. Red palms can look alarming, but redness by itself is not a reliable sign of heart disease. Heat, exercise, pressure, skin irritation, and even holding a warm cup can increase blood flow near the surface of the skin. Some people also have naturally reddish palms. The concern rises when redness is new, persistent, and accompanied by swelling, breathlessness, unusual fatigue, or a racing heartbeat. There is also a condition called palmar erythema. This is when the areas near the base of the thumb and little finger appear red, while the center of the palm may look less affected. Palmar erythema can happen for many reasons. It may be associated with liver disease, inflammatory conditions, hormonal changes, certain medications, or sometimes no serious cause at all. So redness should never be used to diagnose a heart problem at home. Cold palms tell a different story. Your body naturally narrows the small blood vessels in cold weather to protect the temperature of your core organs. Stress can do the same thing. Raynaud phenomenon can make the fingers turn white, then blue, and finally red as blood flow returns. But hands that remain cold in a warm room, especially when accompanied by numbness, pain, weakness, or persistent color change, deserve medical attention. Circulation problems, thyroid conditions, anemia, medications, and several other health issues may need to be checked. Now consider sweating. Moist palms are common during anxiety, heat, nervousness, or physical effort. Excessive sweating can also occur because of certain medicines or medical conditions. But a sudden, cold sweat is different. If it appears with chest pressure, shortness of breath, nausea, dizziness, or discomfort spreading into the arm, back, neck, shoulder, or jaw, treat it as a possible heart attack. Call emergency services immediately. And here is the pattern interrupt. The palm itself is rarely the emergency. The emergency is the change in your palms, combined with what your whole body is telling you. So do not panic over temporary redness or cold hands after stepping outdoors. Instead, notice whether the change persists. Notice whether both hands are affected. Notice whether your breathing, energy, balance, or chest comfort has changed too. Now this is where many people make a dangerous mistake. They see normal-looking palms and assume their heart must be fine. But serious heart disease can exist even when the hands look completely normal. Blocked arteries, abnormal heart rhythms, weakened heart muscle, and high blood pressure can develop without changing the color of your palms at all. That is why looking at your hands can never replace blood pressure readings, cholesterol testing, routine medical examinations, or recommended heart tests. The opposite mistake is also common. Someone notices redness, visible veins, dry skin, or a temperature change, and immediately believes a heart attack is coming. In reality, these changes are often caused by temperature, aging skin, dehydration, allergies, medications, or normal differences between people. So think of your palms like a dashboard warning light, not a complete engine report. A warning light may tell you to investigate, but it cannot tell you exactly what is wrong. Here is another belief that needs correcting. Pressing your fingertip and watching the color return is not a home test for blocked heart arteries. Doctors sometimes use capillary refill as one small part of assessing circulation, especially when a person is acutely unwell. But room temperature, age, lighting, pressure, nail changes, and technique can all affect the result. The more useful approach is to track patterns. Was the change sudden or gradual? Is it affecting one hand or both? Does it improve with warmth? Is there pain, numbness, swelling, breathlessness, chest pressure, or reduced stamina? Those questions give your doctor far more useful information than a photograph alone. And now we come to changes that can be easier to overlook than color, swelling, tight rings, and fingers that seem slower to return to their normal appearance. Look at your hands for a change that may be less dramatic than color, but more meaningful when it appears with other symptoms. Swelling. You may notice that your rings feel tighter. The backs of your hands may appear puffy. The creases around your knuckles may become less visible. Swelling happens when fluid collects in the tissues. Heart failure can cause fluid buildup, but swelling from heart failure is usually more obvious in the feet, ankles, and legs because gravity pulls fluid downward. Hand swelling alone has many other possible causes. These include arthritis, injury, hot weather, kidney problems, liver conditions, high salt intake, and certain medications. So here is the important question. Is the swelling part of a larger pattern? Pay attention if puffy hands appear together with ankle swelling, rapid weight gain over several days, increasing shortness of breath, waking at night feeling breathless, needing extra pillows to sleep, abdominal fullness, or unusual fatigue. Those combinations deserve prompt medical evaluation. Now let us discuss color return. Press gently on a fingernail until it turns pale, then release. Doctors call this capillary refill. It may offer a rough clue about blood flow to the tissue and hydration, but it is not a reliable home test for heart disease. Cold hands, age, lighting, nail changes, and how firmly you press can all affect what you see. A more concerning picture would be slow color return together with cold, clammy skin, confusion, faintness, severe shortness of breath, or a weak pulse. Those symptoms can happen when circulation is dangerously poor, and that situation requires emergency medical help. Also notice whether one hand is suddenly swollen, painful, red, or much cooler than the other. That uneven pattern is less typical of general fluid retention. It may suggest a local circulation problem, an infection, an injury, or a clot that needs urgent assessment. The message is not to inspect your hands obsessively. The message is to recognize change. Compare today with your normal. Connect what you see in your hands with what you feel in the rest of your body, and describe the full pattern to your doctor instead of focusing on one isolated detail. Now let us connect the visible clues in your hands to what medical research tells us about recognizing heart-related symptoms. Recent research involving older adults and heart failure care has emphasized the importance of noticing symptom changes early, monitoring daily patterns, and knowing when a problem should be escalated. The lesson is not that one visible sign can diagnose heart failure. The real lesson is that earlier recognition improves when people pay attention to combinations of symptoms and changes over time. That is exactly how you should think about your palms. A pale, cold, swollen, or sweaty hand becomes more concerning when it appears with a second clue. Shortness of breath, unusual fatigue, fluid-related swelling, and reduced ability to perform normal activities are all important warning signs. Breathlessness may first appear during ordinary tasks, walking across the room, getting dressed, carrying groceries, climbing a few stairs, or bending down to tie your shoes. So ask yourself 4 important questions. Has my walking distance become shorter? Am I stopping more often to catch my breath? Are my shoes, socks, or rings suddenly tighter? Do I feel worse when lying flat? Or wake up feeling breathless at night? These changes matter far more than palm color alone. And do not overlook sudden cold sweating. When a cold sweat appears with chest pressure, nausea, dizziness, shortness of breath, or pain moving into the arm, back, neck, shoulder, or jaw, it may signal a heart attack. That requires emergency help. The safest approach is to watch the entire pattern. Your hands may begin the conversation, but your breathing, Stamina, swelling, chest symptoms, and the speed of the change tell the more important story. So what should you actually do next? Here is a simple plan you can use today, without turning palm checking into a source of fear. First, look at both hands in natural light. Notice any new difference in color, temperature, swelling, or sensation. Then ask whether the change improves after warming your hands, resting, or drinking water. Write down when it began. Note whether it affects one hand, or both. And remember what you were doing when it appeared. Second, check the rest of your body. Have you developed shortness of breath during normal activities? Are your ankles swelling? Are you suddenly more tired? Do you feel your heart racing? Are you waking up breathless? Do you need more pillows to sleep comfortably? These patterns are more useful than palm appearance alone. Third, arrange a medical appointment if the change persists, returns repeatedly, or is accompanied by other symptoms. Bring your notes. Bring a list of your medications, and tell your doctor exactly what changed, when it began, and what other symptoms you noticed. Depending on the full picture, your clinician may check your blood pressure, oxygen level, pulse, blood count, kidney function, thyroid function, heart rhythm, or heart structure. They may recommend an electrocardiogram, blood tests, or an echocardiogram. These tests help identify the cause. A photograph of your palms cannot. If possible, record your weight each morning under similar conditions. Use the same scale, wear similar clothing, and check at roughly the same time each day. A sudden increase in weight, especially when combined with swelling or shortness of breath, may provide your clinician with another important clue. But some symptoms should never wait for an appointment. Call emergency services immediately for chest pressure or chest discomfort, severe shortness of breath, fainting, confusion, blue or gray lips, or a sudden cold sweat accompanied by nausea, dizziness, or pain spreading into the arm, shoulder, back, neck, or jaw. Heart attack symptoms are not always dramatic. This is especially true in older adults. Do not drive yourself if you feel faint, severely breathless, or seriously unwell. Sit down. Unlock the door if you can do so safely, and follow the emergency dispatcher's instructions. Your palms may offer a clue, but your full symptom pattern tells you how urgently you need to act. Before you leave, take one calm look at your hands. Not with fear, but with awareness. Your palms cannot diagnose heart disease, and a single change in color or temperature often has a harmless explanation. What matters is whether the change is new, persistent, and connected to shortness of breath, swelling, weakness, chest discomfort, dizziness, or a sudden cold sweat. Pay attention to patterns. Write them down. Share them clearly with your doctor. And when severe symptoms appear, do not wait for your hands to change again before seeking help. Your body often whispers before it shouts. Learning to notice those whispers can protect your independence, your confidence, and possibly your life. If this video helped you understand the warning signs more clearly, subscribe for practical heart health guidance created especially for older adults. And share this video with someone who may be ignoring a quiet change in their body. One simple conversation may encourage them to get checked before a small warning becomes a serious medical emergency.